It's not good because it validates our worst worries.
Details of secret tapes from closed-door meetings between the government and the Chief Medical Officer of Health released by the CBC. Doctors working in emergency rooms, ICUs, and medical centers like this one say it's proof politics, not health policy, is at the center of pandemic decision-making.
The government has failed to support people who are actually working towards stopping the pandemic, especially frontline health workers. And I think this is vindication for them.
Perhaps now there will be more public buy-in to more restrictive measures, whereas before there was resistance to things.
Dr. Noel Gibney was one of dozens of healthcare workers to sign his name to an open letter to the Premier's office earlier this month, warning the healthcare system was at risk of being overrun if immediate action wasn't taken.
The government is not taking the medical advice of the Chief Medical Officer of Health, and the pandemic is being managed politically rather than based on public health principles.
As for Dr. Dina Hinshaw,
I mean, what I've kind of thought in the last while is I kind of would view her as a hostage. And I think she's tried to the best of her ability to manage this challenge from the inside rather than to let the government have a totally free hand. But it clearly hasn't worked.
I don't think she's going to be any less effective now than she was before. The government simply wasn't listening to her.
There's some indication that she's really only staying in this role because there's a fear that whoever could be put in the role might be worse than her.
But whatever political battles are being fought, doctors remain focused on the real enemy.
With COVID, it tends to be all or nothing. If you don't do the right things, COVID just takes over.
In Calgary, Jonathan Muma, City News.